Welcome to the Mental Insights Podcast, a conversation aimed at understanding all sides of mental health, addiction recovery, and homelessness. Each interview will include one's personal experiences and insights, or an expert's advice and knowledge within one of these fields. The goal is to promote awareness, guidance, and support for anyone who is affected by these challenges. Thank you all for listening. Welcome to the Mental Insights Podcast. This is your host, Brennan Cutuli. We are here today for Season 2, Episode number 13 with Kristi Dename. Kristi is a mental health counselor and biofeedback specialist based in New York. Kristi focuses her practice with neurological, behavioral, and holistic approaches, including EMDR therapy and CBT. She has helped both children and adults through mental health challenges such as anxiety, phobias, migraines, self-care, depression, and much more. Kristi joins the Mental Insights podcast to speak about EMDR therapy and the impacts of trauma on one's mental health. Kristi, thank you for taking this time out to be with me on the Mental Insights podcast.
Of course, you're welcome. Thank you for having me.
My pleasure. I think it'll be good to, dive deep into trauma and especially into the, some forms of therapy that can be had today that are definitely, I think, increasing their, touch within society, such as EMDR therapy and CBT that's used a lot throughout clients today. But to really start off, do you want to just explain more about when you first learned the importance and the impact of mental health on yourself?
Sure. So I realized the importance of mental health in my early 20s, which I'll get back to that because I think it's also important to mention when I realized mental health existed at all. So I specify this difference because many people like myself can know when things just don't feel right within us or within our own brain and our body, and it's confusing, but we don't actually know why, and we might let it pass up too and figuring out why. So when I was little in elementary school around 6, I did suffer from extreme anxiety where it got to the point it surrounded food, and I had thrown up from a hot dog from Nathan's. And for some reason, my little brain was just like, oh my gosh, Nathan's is really bad all the time. And then it extended from there to any restaurant is really bad and I will throw up at any restaurant. And then at school, I started eating only in the nurse's office if I ate at all there. So it just started spreading more and more to every environment that was outside of my home or comfort zone. So if my family did want to go out and I had to go because I couldn't be left alone at that age, I would just go and sit in the bathroom where I would just kick and scream on the way there. There was one point where we did go back to Nathan, so I just kind of sat with my head like down in the booth, just not trying to smell or see anything. And it's cute now and funny, but it was like really horrible then. And no one really knew what was going on. They just thought maybe I was being, sensitive or I'd work through it. And then eventually when months and months went by where it wasn't happening on my own, my mom had me see this school social worker. And, she encouraged me, and so did my family, to push through it. The social worker is really sweet and nice, and she did a prize therapy based approach. So little by little, kind of like exposure therapy, she would have me do more and more, just go sit in a restaurant, then have a French fry or something like that, small, and then eventually be able to enjoy a meal without getting so anxious and associating it with throwing up. And that throwing up feeling too for a child is loss of control, and in itself can be a little bit of traumatic. It could be traumatic to not know how to cope with that overwhelming, those big emotions. So I was taught how to push past it, really. The prize therapy approach can work, but it didn't teach me really skills on my own what to use. It was more external based. So I didn't necessarily learn still why I was going through what I was going through, what it was I was going through. I don't even know if they told me it was called anxiety. So in my then early 20s is when I started seeing different therapists and learning different approaches, and then also went to my own, graduate school and training for mental health counseling. So I learned a lot of skills there to cope with symptoms that I still battled with of social anxiety, depression, mood stability, because again, I wasn't taught the skills up until then. So as a teenager, even more, a lot more commotion and hormones came in and flooded that, and still I lacked the skills. So once I learned them, I practice, still even to this day, because I preach it. I'm very diligent, and let my clients know that it's crucial, that practice is so important. And I don't teach or have any therapeutic approach that I actually haven't done myself, because if I don't believe in it or know it's effective, and I don't encourage others to do that. So it helps you build emotional intelligence too, and for me, it made me a better therapist in person for myself and those in my life. So if we backtrack a bit now to recognizing the importance of mental health. So when I was about 23, I worked in a psychiatric emergency room. And that experience of seeing the hardship that others face as well, paired with my own journey and recovery, it really taught me the significance of mental health and how it can just rob you of your personality, and even like shackle you to your disorder and your symptoms, and then prevent you and limit you for what you want to do in life. So our emotional health, or overall education about the inner workings of our bodies, our brains, our minds, and that inextricable link between mental and physical symptoms was really just blatant to me at that point, that it was so important to us. If we don't take care of our mental health, we also can have a negative effect not only on ourselves but our environment and our interpersonal relationships, as well as that intrapersonal relationship. And we want to see health as an umbrella term for not only just physical health, which is usually what people think of first when we hear the word health, right? So it's not just that, it's our mental, our emotional, our spiritual, and our cognitive health as well. So I think when we cover all of those facets of our health, then magnificent, really beautiful things occur, and we can blossom and have positive ripple effects as well, not even within our own lives, but within the people within our lives and our environment, and have that forward movement. So when we do take care of our health in its completeness, it is not only vital and beneficial for ourselves, but for the world at large. So that's how I know it is significant to answer your question.
Thank you, Kristi. I appreciate it. It's definitely helpful for you as you're working with clients, as you stated that you've experienced similar things, and as well you've firsthand used some of these activities, some of these techniques in order to see their true benefits. And I think, as we're speaking about different therapeutic approaches that you use, EMDR is definitely one of, it's a large forefront in techniques that are used for, many trauma-based, challenges that people face within their life. And for those out there who may have not heard, we haven't really spoken about EMDR on the Mental Insights podcast yet. So what is EMDR, and, who can it be helpful for?
Okay, great. Well, I'm glad that I can be the one to educate and talk about this. I love EMDR. Just a little background why I got into it. Years ago, almost 6 years ago now, I had a trauma that I wanted to obviously process, and being emotionally intelligent at that point too, I was like, I know this is going to cause me difficulty, so I lined up a therapist to happen right after, essentially, and it was just transformative. And it's amazing. Since then, I was like, I have to learn this, I have to offer this for my clients, and I went to the trainings, and I did. And just the clients that I do work with, it's like they travel through this tunnel and then come out into this light and this rainbow area and just all these revelations. So what it stands for, now to go into the history of it, is it's eye movement desensitization and reprocessing therapy. So this was actually founded around 1990, early 90s, by Francine Shapiro, and she had her own journey with it. She realized she was walking, and when she was walking and just kind of ruminating about something stressful, it started to unravel, and she was just getting clear insight. And she was like, why, she was looking around, wandering, and she just was wondering what it was about looking around in movement, bilateral movement of the left and right, that helped and enhanced that process of working through something calmly too. It brought her back to a calmer place. So she saw that with any cognitive process, I mean, even me now, like as I'm thinking about anything to come up, you move your eyes. And during REM sleep too, we obviously rapid eye movement while we're working through and sorting through anything throughout the day that was difficult. So eye movement is just in the brain, there's so much that is happening to help you process something and recall memories too. So that was one part of it. And then the left and right piece is, what for walking, is any type of bilateral stimulation in general is opening up the left and right brain so they can work together. So it's emotional side being now paired with the left logical reasoning neutral memories to pull with. And this helps us then have that balance and that wisdom of incorporating both. So while I'm thinking of something emotional that's distressing, I'm able to still bring in effective logic and reasoning of how to solve it or how to go about it and handle it. So for those who've had trauma, the brain is just wired differently, especially if trauma was critical or was through critical years of brain growth, then it's really going to affect the structure of the brain. And they see with MRIs and fMRIs that when someone's heated or lit up for having a trigger, let's say, that reminds them at all, even if it's something as simple as someone's tone or a sound that just reminds them of the trauma, their emotion center in that limbic system flares and it's just firing, and it hijacks. They see this whole area just shuts down. The bridge of what connects our right brain and left brain is not as strong. It's very frayed and weak in people with trauma or certain disorders too. So they literally can't access that part. And that's why they react as if they're having the trauma again. So originally this was for PTSD, and they have so many, there's research based that it works very effectively for that. And then over the years, they realized that it can actually help with any type of trauma, any size, any shape, whether it's chronic or one isolated event. It can actually help with anxiety, some phobias too. It's got an exposure therapy approach, feel to it. So different obsessions that might happen. And originally she had, for the eye movement part, had the client follow her hand like back and forth this way to have the eye movement incorporated left and right. Now, with more modern times, over the years, they've crafted what's called tappers. So you hold these, they look like pods kind of connected to wires, and they vibrate back and forth. And as the clinician, we control the speed and the intensity of the buzzing. So that does the same bilateral stimulation. So it's lighting up left and right without having to like tire the therapist's arm out or just feeling, I don't know, just incorporating technology, which people like. You can also do binaural beats too, which is at the same time you can do that, where you listen to music or beeping even back and forth, and that also can light up left and right brain and light they do light boxes now where a light goes back and forth, then you can watch that too. So there's all different modalities of it, and people combine them. Sometimes people just want one and their eyes closed. It's kind of feeling out what works best for them and gets to them to retrieve the memories and process. There's a lot to EMDR, obviously, and I'm very passionate about it, so it's exciting to talk about. It's a three-prong approach, so it's not just past, going into the past, it's also past, it's present, and then future. So we bring the past into the present to process it, and then after it's fully processed and we feel like that we're at a good place, then we look at future scenarios that could be triggering and how to go about them. There's 8 phases total of EMDR. So history is taken, but trauma history, so it's a little bit different from a normal intake. If you were going to therapy, we look at genograms too of family traumas in the past, or if your mother had a trauma during your pregnancy even, or the labor and delivery. So that's the generational trauma that could be effective, and then your own personal history of trauma. Then the second phase is preparation. The preparation phase can actually go from 1 or 2 sessions to 1 to 2 years even. It depends on the coping skills that the person's coming in with, their resiliency, their just willingness to get there. Some people come in and they're like, I want to do this, and I want to get right in there, and then they get a little intimidated and they're like, I don't know if I want to start this right away. So then we do more preparation. We might talk about it a little more gently each time, work on skills, coping skills, self-regulation skills, grounding, mindfulness, anything that can help them be able to cope when we do discuss and bring up trauma memories. Then we have the third phase, which is assessment. So the assessment is when we look at and try to identify the memory or issue that we want to target. So together we would assess that and what emotions, beliefs, and sensations are associated with that target. Target could be earliest memory or worst memory. We kind of want to find one that lights them up a little bit more, because that's going to be the best to go into. And then the phase 4 is when it's happening. So the desensitization process, it's called, is when we have the bilateral stimulation that I was talking about. And this, at the same time, they say the D is for desensitization because the buzzing and the back and forth looking to is soothing for the brain. Just like I said, a walk, after a walk, you feel pretty calm again, or you can all of a sudden you resolve the issue, or you're able to talk to the person again, because it's that desensitization. So you stop associating the memory, the trauma memory, with a lit up, tense body. So as you're bringing it up, you're also calming your system to associate it with different sensations. So that's the somatic piece. So we want to light up the memory networks associated with that trauma memory, right? So it's almost like a corrupt file on your laptop that it's sitting there, the trauma memory, but you can't open it until you have the right system to open it and unlock it. So EMDR is kind of, that's similar. It's unlocking that memory that's lodged and stuck in the limbic system back here and filing it properly, sorting it out where it's supposed to go. So it occurs in sets. You might do 30 seconds to a minute, depending on how accustomed you are and get more comfortable with the process. So you go, the tappers go back and forth, or you watch the light bar back and forth, and then I'll pause it and check in. So we go, usually the language is like, what are you noticing? What'd you get? And majority of the session is quiet. People range from telling me every single thing that they processed in that set. And then some people just do 1 or 2 words. It's whatever you want, because you're fully in control of this type of therapy, and that's why it's so different. The therapist's role is to guide you. So essentially, the client's in the driver's seat of a car. I'm directly behind them, so I can only see what you're telling me you see. and then I can guide you from there. And if you want to pull over and take a break, you can. If you want to go, if you're stuck and you don't know which way to go, that's my role to help you get through that piece too. But it's all based in the brain is meant to heal and adapt. So it's going to do that. So you're going to do that yourself. And that's what's a great piece of it. The brain has a natural ability to heal itself. So once that happens, we do installation. So let's say all the reprocessing is done and the person feels like they really worked through it and there's so many changes in their life that they're seeing, whether it's with other people or they're ending a toxic relationship or they're just freer and they're enjoying life more. Then we look at installation of the new belief and insight. So that's just kind of with the tappers at a slower pace, reinforcing that new belief of I am safe now, or I am worthy, or I am lovable, I am capable, I am strong, those type of beliefs. Versus a trauma stuck belief can be I'm not safe, I'm in danger, I'm not lovable, I'm not worthy, I'm insignificant, I'm unimportant, and so on. There's a whole list we have of cognitions. Then we do a body scan, bring up the memory again, phase 6, check if anything in your body shifts. If there's still a shift of any tension, we go in again, see why. At the end of each session, there's closure, like debriefing, and I'll do maybe a little guided meditation for them to just ground themselves. Never want to leave a client if you're an EMDR therapist. It's very bad if you go to the last minute and then they're crying and you're just like, okay, bye, got to see you next. So debriefing is very important phase. And then reevaluation. So every next session, I'll ask the client, did they have any dreams, thoughts, triggers, new memories that come up? To journal that in between sessions, and then we go from there. So, and then as I mentioned before, the future part comes in once we know for sure we've unraveled as much as possible as we can and they feel resolved. Then we look at possible future scenarios that could trigger and how to get through them effectively with these new skills and ways of the narrative basically of the trauma.
That's great. And, as you're stating, there's a lot of great things I think to touch upon, but I think one being is the aspect that many people, when they either hear or have experienced a trauma, they always believe, given with triggers, that going back to that point is something that will only bring them more, more pain and more angst. Yet when we look at a lot of the therapeutic measures that are being used today, given the right space, given the right environment, the right professional, you're supposed to tap into that in order to see how you're able to move forward past what you experienced. And I recently read a book that was really interesting, and it wasn't necessarily on treating trauma, but it was about the near-birth experience. So it's trying to flip the script on the near-death experience. And what the author, Jerry Bongard, does is he brings his clients through a therapeutic measure to try to visualize their experiences, whether it was at conception or whether it was even before. And a lot of them, it's more for spirituality of seeing a light, seeing someone who, is more than themselves. But what he was able to see was that, once you gain a comfortable environment, once you tap into the subconscious of your client, once they're willing to go deep into themselves to do this healing work, it shows that we're able to not only visualize, but experience things more than ourselves, and is able to help people, whether it's through, grounding themselves and seeing, all right, like I have worth in my life. And he did that through a lot of people who, experienced many, different traumas, whether it was in their childhood or whether it was, having a lost sense of self, whether they were extremely suicidal. And it's, it's interesting how there's these therapeutic approaches. Even today, I think it's in its last phases of clinical studies for psychedelic use for
Mhm.
PTSD to basically go back into the experience of what your trauma was, but to reframe it, to look at it into a new lens. And given EMDR is kind of this multi-step process, you have to
Mhm.
use both, all the past, present, and future. I want you to explain more about how you're able to, create an environment where your client's going to feel safe and comfortable. Because I think for a lot of people who
Mhm.
may be listening, who maybe have not reached out or have experienced something recently, that they don't know how they can come face to face with maybe something, so traumatic that they've had within their life, but they don't know how they could maybe, take that step of saying, all right, I need to deal with this head on rather than, trying to bury it within. Because for myself, that's what I did as well. As I had a traumatic experience and I buried it. And then I
Mhm.
didn't use these emotions. I didn't know how to handle or cope with these emotions. And then you can see the repercussions 10 years down the line. So can you speak about how important that environment is, and how you're able to bring that into play within, especially EMDR therapy, which
Mhm.
really centers within the visualization approach of what you've experienced?
Sure. Yeah, it's crucial, especially if you're a trauma therapist, to create as soon as possible that warm, safe, supportive environment. So, for you mentioned for people how to go about it if they are definitely going to have those thoughts of, how do I want to talk about this to a stranger, or are they going to be scary? Are they going to judge me? There have been scenarios where I've heard therapists do have this expression on their face of horror when someone is sharing a trauma, and then that could put a sour taste in their mouth about therapy, or whatever their, if they've never gone to therapy, what their expectations might be, or their biases, or the stigma behind it. And like you said, you also might already think you're handling it, even though you're compartmentalizing or just suppressing and burying it deeper, but they become landmines, So, and just like anything you try to suppress, I picture a beach volleyball type thing. If you just keep trying to keep it underwater, eventually your arms will get tired and just gonna like slap you in the face. So there's always going to be those moments that it's just going to all come out again. And then you try to put it back, and the same thing, just not actually resolved. So the I think as a therapist, the environment itself is important. So if your room's very clinical looking, that can already be a vibe that's not, it's cold. Essentially, if the room itself is cold, that actually does have an effect on people too. They see that warm environments help them perceive the person, warm temperature wise, I mean, as warmer, which is interesting. So that's a key, is the temperature of the room. If how your layout is, if you're very far from your client versus a little bit less distance and not a desk in between you, or those clinical looking chairs. So I purposely picked the office in the practice I work with to be smaller, because I do think, not right on top of each other, but just close enough where it is a safer, more intimate feel, because they are sharing so much heaviness and pain. And to just give them that ear, that you're there for them, and that it's an honor. I share that with them too, that it's truly an honor to be able to witness that and be there for things that they might not have ever told anyone, even themselves, out loud, or realize themselves. So I think that part alone, and sharing that with them, helps create a safe environment. And just building rapport, of course. If I can tell they have a good sense of humor, I'll bring out my humor and use that, pull on their strengths. I ask them about their interests, and see if there's any bonding opportunities there. Just stay laid back, calm for them. It's definitely a lot of body language changes too, but it's so important. So I think that all of those facets do help set the tone for them. And also just letting them they're always in control. They can tell me as much or as little as whenever they want in any session. If we want to have a lighter session and they just talk about a show they liked recently, that's okay. And I ask them too, do you want me to bring you back if I notice you're avoiding it again? And they'll usually be like, okay, yeah. So it's just being very transparent too with them, I think, and not judging, of course. Like, everyone has a story, and the fact that they can sit there to tell it and be such a survivor is also so commendable and just extraordinary. So I think all of that helps my clients feel safe when they come in.
Great. Thank you for that, Kristi. And, to speak about your other specialty being biofeedback, can you explain what that is and maybe how that is able to help anger?
So biofeedback is another great science-based, physiological-based approach. And if you notice, EMDR is neuro-based as well. So I love combining what's actually happening neurologically and in the brain with the psychological approaches too, or thought work like CBT. So it's a set of different techniques and sensors really that are measuring what the body's doing. So it's kind of similar to a thermometer. It gives you the feedback of what your temperature is. So there's a sensor for our heart rate variability, which is what, not just the beats per minute we can see, but we can see how the heart's fluctuating from beat to beat. So when it starts rising, we see that. And as it falls, we see that on the screen. And with that, we can see breathing rate through our heart rate. So when we inhale, our heart rate increases. And when we exhale, it decreases. So we can, on the screen, see your breathing depth and the rate. So that's HRV, they call it, heart rate variability. Then we can also see muscle tension with electrodes. Again, nothing going in, it's just measuring. Those are EMG electrodes for muscle tension. And then we can look at sweat activity and conductance, which is representative of the nervous system firing. So it's not measuring like dripping sweat. It's more so that minute cold and clammy type feeling that can happen when we start getting more anxious or stressed. And then there's, what do we say? There's brainwave activity, brain metabolic activity. Those fall under more so neurofeedback, but it's still biofeedback because it's still a biological process. Then they do have pelvic feedback. I don't do that, but that's another one. And I think that covers all of them. Yeah. And so to be fed back immediately what's happening in your body, it helps self-awareness, of course, education of what's happening in your body and why, and how it looks when adrenaline comes in, versus the opposite if we're in rest or digest too long too, which can create a depressed state. And there's different screens too that you keep going. So there's game screens, there's environment scenes that you walk through that are really beautiful. There's beach screens. There's just the clinical screens where they watch their vital signs basically going. But the point is you get fed back instantly. So let's say there's a game, like the kids will play a race car game. The car will stop moving when their body starts stressing again, or if they're getting restless. And then they have to breathe and learn that a calm body is more in control, and then their car will drive again. So it's twofold, where consciously they're getting the message. The reward is through being calm, and also me educating them and encouraging them and supporting them along the way. And then unconsciously, the brain is getting that memory now, that muscle memory of breathing slower, more diaphragmatically, how it feels to be in a calm body. So those are the really great benefits and self-regulation skills that they gain through biofeedback techniques. And for anger, we see how the body gets very heightened with anger. So it's a high arousal state, right? So heart rate's going to be going up. Breathing rate and depth, you're going to most likely see shorter, like quicker fluctuations in the heartbeat versus nice waves when we're breathing in and out slowly. It's going to be more tense and held. We might hold our breath when angry, so you'd see the heart rates just kind of staying at the same beats per minute. And anytime we distress our system like that, you're sending a signal to the brain that something's wrong. So when we're in fight, flight, or freeze mode, right, and something actually is life-threatening, you might hold your breath because you don't want the person, the criminal or whoever, to hear you. Or you might breathe more quickly to get more blood flow so you can run and dash out of there. So there's reasons for it, but when we get extremely heightened and angry, and then we fuel that feeling, and then our brain's like, alert, 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 you must do something about it now. That's when outbursts can happen, lashing out, throwing things. The brain's like, there's pain, there's something life-threatening, get rid of it. So you start just getting like hijacked, and will let emotion take over your behaviors. So with the biofeedback, I actually will have them maybe mimic or bring up something that aggravates them. First, start with a mild stressor and see just the difference that starts happening within their body. And then they bring themselves back to a calm baseline. So essentially, we see how you can feel angry. You don't need to be angry in your whole entire being. We can actually still say, I feel angry in a calm body. That can go into a whole other realm of emotional states and what they are, but that's how it helps with anger. It's like to give a longer pause in between what just happened and what am I going to do about it. When the pause is like this, it's short fuse. That's when you hear people say I went from 0 to 100 because they have no pause. So biofeedback and other skills to start lengthening that pause and that prefrontal cortex part of the brain, that's the yellow light of your brain, essentially, like the pause, checking, impulse control. So it's not only just cognitively you're learning it, it's actually strengthening your brain and building neural networks.
Wonderful. Thank you for that, Kristi. I appreciate it. Definitely some great information within biofeedbacking and as well EMDR therapy. And I think this is a good time to have, this segment of the episode, and we'll transition into part 2 where we'll speak more about trauma, and we'll speak more about what some of these causes are, what are some of the effects of some of these issues. This will give you more context into these therapeutic approaches that Kristi is using within her work. So, I just want to thank you for being here, Kristi, and sharing this information, and make sure everybody tunes into the next episode.
Thank you. You too.
Wonderful. So thank you all for listening. This was part 1 of episode 13 on season 2 of the Mental Insights podcast with Kristi Dename. And please be sure to tune into the next episode to hear more about trauma and some of the therapeutic measures that Kristi works within. So thank you all for listening, and let us know what you think. Thank you all for listening to today's episode of the Mental Insights podcast. Make sure to reach out to today's guest or myself if you need any advice, guidance, or support in your life today. Please be sure to like, subscribe, and review to this podcast so we know what you thought of this episode. I look forward to being in touch with you all in the next episode. I hope you all have a wonderful day.